Hi, everyone. I'm Ashley Bassett,
And I'm Catherine Logan.
and welcome to another episode of Game Plan. So, these Game Plan episodes are specifically designed for our patients to hopefully answer some of the common questions that you have about sports medicine conditions and some surgical treatments. But today's episode is a little bit different, and we're really excited about it. So, today's episode, we're going to focus on common injuries in the NFL and then how these injuries impact players' time missed, how much game they play, how many snaps they play, and how their injury affects their performance moving forward.
Something that each NFL team looks really carefully at when they're evaluating whether it's rookie prospects before draft day, as well as when they're thinking about trades. So teams look at a number of previous injuries, the types and severities of those injuries, as well as the treatments that were rendered to try and decide the ranking for that draft candidate. So this is just one facet of the evaluation. A physical examination is also performed at the combine, and those performance metrics post-injury are obviously taken into account.
But as the literature continues to grow in this area, it's becoming more and more feasible to project a player's injury risk, their career length, and then their performance as well. And this is useful information for NFL teams, but also for avid fans of fantasy football when you're trying to determine who to draft for your team. So our discussion today is really going to focus on those common injuries and how that injury history may affect player reliability, meaning are they going to play all the games this season, and how it's going to affect their performance most importantly.
Yeah, so we're going to try and hit a lot of the common injuries today, but you can also look out in the future for this season. We're going to be highlighting injuries as they occur and how we believe this is going to impact your favorite players and teams. So I think we're going to kick it off, Ashley, with clavicle fractures.
Yeah, we figured we'd just start at the top, work our way down. So clavicle fracture, for those who aren't familiar, it's also called a collarbone fracture. It's essentially a fracture of the bone that spans from your sternum, or what's called your breastbone, over to your shoulder. Most commonly, the fractures occur in the midshaft, which is the central aspect. We'll have a nice diagram up for you. And it accounts for about 10% of all sports-related fractures, and it's very common in contact athletes. So these fractures can be treated both surgically or non-surgically, and there's ample literature to support both. And we have, a few articles that we can discuss a little bit further, Catherine, but those 3 articles looked at both operative and non-operative treatment. So we'll dive a little bit more into that. So in terms of, let's start with the most important thing, right? So in terms of performance, it was a little split. So the one article that looked at operative treatment found decreased performance, specifically in quarterbacks and running backs. But it is important to note that this paper looked at the injury in quarterbacks, and those injuries involved their throwing arm, versus the other paper, which found no difference in performance, looked at injuries in the non-throwing arm and found no difference. So I think that's really important. And then the paper that looked particularly at non-operative treatment actually found no difference in performance metrics. There were equivalent games played, and there was no impact on career length.
Yeah, and I think, let's talk also a little bit about position. So part of it was the decreased performance was found primarily in quarterbacks and running backs. And then there's also decreased games played in wide receivers. And then we should also talk a little bit about what about if this is their, for those quarterbacks, is this their throwing arm or is it their non-throwing arm? So a lot of the injuries that we've seen, whether it's like Aaron Rodgers, it's been in their non-dominant, their non-throwing arm. So that does come into play. But if it's going to be their throwing arm, it's obviously going to be more severe.
Absolutely. And I think it's also important to note that people that sustained clavicle fracture, whether or not they were treated surgically or non-surgically, had a really high return to sport, but the time to return to sport was really long. So it was about 211 days in the surgical group, 244 in the non-surgical group. So if your athlete sustains a clavicle fracture in season, you probably want to drop them because they're not returning anytime soon. So as you pointed out, Catherine, that's perfect. So quarterback throwing arm fracture, probably not the people you want to go with. But interestingly, most of the quarterbacks, at least that I found in searching, it involved their non-throwing arm, right? Like Nick Foles, Tony Romo, Aaron Rodgers was another one in 2013. So I think it's uncommon to involve the throwing arm, but if it did, I think that's something to pay attention to.
Yeah, I think really, if this is happening to someone on your fantasy team, you are going to take a pass on this player.
Absolutely. Awesome. So why don't we shift to shoulder instability? Catherine, do you want to kick this one off?
Yeah, so perfect. So shoulder instability or shoulder injuries in general are pretty, common in NFL athletes. So the statistic for shoulder injuries is somewhere between 10 and 15% of all the injuries occurring in NFL players. So we're going to focus first on shoulder instability because this is one of the most common. So shoulder instability is, so the shoulder's a ball in a socket joint. So it's when the ball pops out of the socket. We always talk about it happening in like more of like a high five type position, and the ball usually goes out forward or in front of the socket. Sometimes it has to be popped back in. Other times it'll pop back in itself. We'll also touch on a little bit later the AC separation. Sometimes people get those confused. Those are different things. So when people talk about shoulder instability, it is the ball popping out of the socket.
Absolutely. So I was really surprised by the results of this. I thought for sure that it was going to show a decrease in performance. And I was really stunned that all the papers across the board, except for one, showed no difference in performance, no difference in games played, no difference in games started or snap percentage across all forms of anterior shoulder instability treated with or without surgery. So I was really, really surprised by this. I think there was one paper that found decreased games played and decreased career length, but I think it's important to note this was an older paper and they did the surgical repair with an open approach, which most people are not having anymore, right? I don't know, Catherine, if you're doing a lot of open shoulder stabilizations in terms of Bankart, I'm not. And I think doing that minimally invasive approach, I think kind of preserves a lot of like the muscle in front of the shoulder, which is that subscap, and that can lead to some kind of dysfunction in the future. And so preserving that, I think, can be helpful. So I was really surprised. What did you think about this?
Totally. I think, there's a difference between whether or not they had surgery or no surgery. So I think that's really the most important consideration for looking at your players. So there was this article in AJSM where they looked at, I believe it was like 83 NFL players who had in-season shoulder instability. So they had a dislocation that happened in the season. So if they did not need surgery, and that's obviously determined by a couple factors that we'll go through, but if they did not need surgery, they were generally back between 0 and 3 weeks. So very quickly to get back in season. However, if they did need surgery, the average return to play was 9 to 10 months. So much bigger difference. So why do they need surgery? Why do they not need surgery? So it really depends on a couple factors. One of them being, is this the first time they had a dislocation? If it's the first time they had a dislocation, they're probably going to try and proceed without surgery, especially if they're in season. But then also, sometimes that socket or the bone is also damaged, and they end up having a little bit of like a fracture or sort of like bone loss to that socket site. And that's going to affect, it kind of pushes someone's hand one way or another, or maybe they're not be able to tolerate non-operative management. But I do think, whether or not they have surgery or not, that's really going to determine the timing of return to play.
So Catherine, yeah, that's a really great point. And I think as we just spoke about with Brian, that the initial treatment of shoulder instability, it really is controversial. Probably the right thing for these patients is just to go to surgery, but with multi-million-dollar contracts on the line, not a lot of people are going to opt for that. But there was a recent paper looking at return to sport. And though they showed that, first time or second time instability was able to return and without surgery return quicker, they had over 40% recurrence rate, right? So I'm thinking about just recently in the news, Mike Gesicki, tight end for the Patriots, just dislocated his shoulder in preseason, I think at training camp. So we're thinking, all right, if he gets back in 10 days, that's awesome. Is he reliable? Is he going to pop back out in the season? And then is he out for the whole season because he's going to go for surgery? Or is he going to go back in and just pop out again? Now, we obviously don't know the details, haven't seen his MRI, don't know if it was a dislocation or subluxation, but just important things to note that we may pat ourselves on the back and say they got back in 10 to 14 days, but are they going to stay in? And so that's someone, sorry, Mike, that I might pass on this year just because it's really unpredictable.
Yeah. And then I'll also just give a shout out to one of our mentors, Dr. Mark Price. We did an episode with him. Gosh, this was 21.
Yeah, it was early. I was like our second or third episode.
Okay. So I think it's 2021, but longtime NFL Patriots doc. And he talks specifically on shoulder instability and that management and return to play. So more of a deep dive there, but definitely check out that episode and we'll provide you guys some links. So I think takeaway is really, yes, the literature does not show any negative impact on performance after shoulder instability, like within that first season. Are there some different long-term changes and like career length changes? I think possible. But really the main difference is timing. Are they having surgery or not? If they're having surgery, they're definitely not coming back that season. And then if they're not having surgery, you can expect that they'll be back just within a couple of weeks. It's just a risk to take because we don't know if they're going to do it again.
Absolutely. So we want to do some quick quick updates for some injuries, and we're going to do individual episodes on this as the season goes along. So pectoralis major tears, which is essentially the muscle that overlies the chest. There was 2 papers on this, and interestingly, neither found any difference in performance, career length. They did find some decreased gameplay, though, upon return after surgery. So keep that in mind. I really found that shocking. Like, it's such a major injury and repair that there was no impact on performance. I found that really surprising as well.
Yeah. And then as far as like a quick side, as far as how that happens, it's
Mm-hmm.
often on bench pressing, I feel a pop. So
Yep.
I haven't seen many, I don't know if you have, but I haven't seen any that have actually really occurred like in game. It's generally in training.
Absolutely. I agree.
So the next up is a slap tear. So what is a slap tear? We hear this all the time. You hear it a lot in baseball, but a slap tear, it's the superior labrum. So the top of like basically our socket has a bumper around it that keeps the ball in place. The top of it is called the superior labrum, and a superior labrum tear that moves from the front to the back or anterior to posterior is a slap. So that's what that all means. Superior labrum, anterior to posterior, slap tear. So basically what you see when this happens, and there's only been one paper that I know of, perhaps there is some more literature brewing, but this is not a really common injury that you're going to see, but that there's decreased game played in the overall. But I don't know, anything else that you want to add about that? It's not really common.
Yeah, not particularly common. I think also sometimes, as we've discussed too in some of our episodes on slap tears, and incidental findings. So how much is that really truly the pathology at hand, especially in football? Like I think we more see that in the baseball population where it's clearly symptomatic. I wonder how much of it is really truly in the NFL or just wear and tear.
Agree. I
And
think if
then
it comes up as their injury, it's probably not a huge deal.
exactly. And then another one that surprised me is rotator cuff injury, though I could only find one paper on this. So I'd be curious to see if more literature is coming underway. I'd also be curious to know really how much of these rotator cuff injuries were true injuries and not just tendinosis, which is a little bit of inflammation or breakdown of the tendon versus a complete tear. In my mind, if someone's had a complete tear and a repair, I can't see how that wouldn't affect performance. But this paper did find that injuring the rotator cuff did not have a significant impact on performance, but did associate with decreased games played during the season and decreased career length.
All right. I think that's it for the
Yeah.
shoulders.
Mm-hmm.
And then we'll do a separate, we have another episode coming up soon about AC separation. So acromioclavicular joint separations. But otherwise, let's move on to elbow, forearm, and wrist.
Yeah, so quick ones about that. So forearm fracture, Rob Gronkowski, I think we all are familiar with. So those that undergo ORIF, equivalent performance, as he clearly demonstrates, and decreased games played and career length as well. I think we're seeing a theme here. I think having an injury is going to be associated with maybe not playing as many games at first or second season back, maybe impacting your long-term career. But interesting that a lot of these aren't showing an impact on performance.
Totally. And moving on to, distal biceps. So if the bottom of the biceps or the biceps cross the elbow, if that pops, what happens, Ashley? What are you finding?
So typically you're seeing a lot of bruising, swelling, and then we look for what we call the positive hook test, which I'm sure we'll put an illustration on, where basically you try to hook that tendon. In the absence of that tendon, it's usually a positive test. And we've actually done an episode on this, specifically looking at distal biceps repairs, different types of repairs, the complications associated with each type of surgical technique. So you can check that out as well. But this found, again, this was a little surprising too, no difference in performance, possibly decreased games played an impact on career length. One paper said yes, one paper said no. But again, you can expect these players, if they return to play, to come through for you in terms of performance.
Yeah, I agree. I think, it's one thing to have a distal biceps and being in a throwing athlete like baseball or, some other like climber type thing. But I think there's a lot of other helpers that people are going to use throughout their upper extremity in the NFL that this becomes less of an issue.
Absolutely.
So
and then, yeah, I was
scaphoid,
going to say, my least favorite, hand and wrist. So I'll let you take this one, Catherine.
Yeah, we're going to gloss over hip real fast.
Exactly.
But yeah, so scaphoid fracture, this is basically a fracture that's more, it's one of the small bones at the base of your thumb.
Mhm.
It's one of these fractures that can kind of go unnoticed. We always talk about it as far as like within our orthopedic training as something that when someone has a lot of pain sort of in that bottom of their thumb area, you have to really have a high suspicion that there's an injury. Even if the x-ray initially looks negative and we don't see anything really obvious, we have to repeat that x-ray a couple weeks later to check to see if it's there or get an MRI. You know, and an NFL player, they're obviously going to get get an MRI.
Mhm.
But so what happens if we have that scaphoid injury? So basically, there's only one paper. This is also less common in the NFL players, but if you do see it and they have surgery, it basically means that there's gonna be a reduction in their overall games played, but their performance metrics are totally fine.
Excellent. And then a thumb UCL injury, which is not to be confused with the elbow UCL injury that we've talked about many times on this show. But it's a stabilizing ligament around the thumb that just prevents your thumb from booking open, can be injured, especially in throwing athletes when that thumb kind of gets pulled and wrenched. Where there was one paper that looked at repair and found equivalent performance, games played, and career length. So this does not seem to impact whatsoever. So now let's move on, move on to the lower body. So let's talk about hip impingement. So hip impingement, Catherine and I's favorite, is essentially when there is an abnormal bone growth on one or both sides of the hip joint, which is the ball and socket joint at the pelvis. And this abnormal kind of bone growth can cause abnormal forces through the hip, which can cause tearing of either cartilage or labrum, which is the lining of the hip socket. This can cause pain, stiffness, and dysfunction. But good news, there is a really great surgical treatment for this, hip arthroscopy, and many papers, I was able to find 5, found no difference in performance after undergoing the surgery. Again, another shocker to me, given how kind of unpredictable outcomes are in the general population after undergoing that surgery. What do you think, Catherine?
Yeah, I believe it was like the return to sport was like over 90%, like
Yeah.
92.5%. And
Hmm.
they generally return to sport at an average of 6 months, and there's no difference in their performance when they return. So, you know, I think it just probably says a little bit more about the sport. I think when we do see that reduced performance for return to sport after hip arthroscopy, some of those more really hip dependent sports, whether it's like a hockey goalie, so an
Hmm.
NHL goalie, or even just like an NHL skater, as well as like figure skaters, dancers, you know, where there's just a little bit more demand on the hip as far as motion. We're not seeing those same performance levels. So it's probably just relative to really what we're asking the hip to do. So
Absolutely.
surprising, like I would think like any sort of major surgery is going to reduce your performance, but this is just not one of them.
Yes, exactly. Yeah, I think this maybe even points to people with symptomatic hip issues that may be hesitant to undergo surgery because of the outcomes that we're seeing in more of the general population. As you kind of pointed out, you're putting your hip through so much more stress. These
Yeah.
NFL players are putting the hip through so much stress that maybe addressing that underlying abnormal forces and abnormal bone growth can really help them, get better function of that hip. And I think too, and I don't know if there's literature to bear this out, but we'll talk a little bit about core muscle injury. I think having restricted hip motion, that motion has to come from somewhere. And I think it communicates above and below. And you can probably talk more about that,
Yeah.
from the PT side. But I would think that, there's a higher risk of potentially hurting other soft tissue structures around the hip if you're not having that improved hip motion. So I almost wonder if that increases their ability to get back in and to perform so well.
Yeah, I mean, I know in the lacrosse world, we'll see a lot of times that concomitant or, happening at the same time where they'll have a core muscle injury or what you
Mhm.
hear like a sports hernia, quote unquote, that catch-all term. And they also have some hip pathology. And then, if both are not dealt with, they're still left with the problem after undergoing one of the two surgeries,
Mhm.
or, just not rehabbing both successfully. So I think they do go a little bit hand in hand. But I think if it is someone who has a pure just hip pathology, I think the takeaway is go ahead and draft away. There's numerous studies that have no negative impact on the player's performance, their games played, or their career length after they have a hip arthroscopy for FAI or labral tears.
Absolutely. So now we're going to leave the happy part of our talk today and talk about an injury that absolutely impacts performance,
Yeah.
unfortunately. So our favorite topic, not for this reason, but ACL tears.
Yeah.
So ACL tears, I mean, we can rattle off all the athletes that have had ACL tears. Kyler Murray, most recently in 2022, Javonte Williams, we have Sterling Shepard, Odell Beckham Jr. has had 2 in the same
Two.
knee.
Yeah.
Two. So it just there's and you see the data really bears out. Unfortunate, it doesn't look too good. So there's a lot of papers. The one that really shocked me was one. It was in 2022, which showed that the return to sport rate was only 55%, and then when they looked at 3 years, only 28% were still in the league. Like 3 years after you rehab for at least a year after the surgery. So what is that? 2 years, and then you're out. So I think it's a pretty devastating injury, and not only impacts your ability to stay in the NFL, but also many studies have shown that it really impacts performance. And Catherine, maybe you can share a little bit more about that.
Yeah, for sure. And one of our mentors, Preventure, who also used to be with the Patriots, he published on this topic too a few years ago, and found that there was no matter if you're just looking at all players, all sort of positions coupled together, that there was decreased games started and played, as well as decreased snap percentage. So. But I think, if you tease into the literature a little bit, like, does anybody do okay? And we found that the quarterbacks actually do okay. And we've seen this, so Tom Brady had an ACL, other quarterbacks have had an ACL. So
Joe
Burrow.
Burrow. Yep. And he came back.
Yeah. So I think, if a player is safe, it's going to be your quarterback. Where you're really going to see that decreased performance as far as like who really, suffers from this, it's your running backs and your wide receivers, which makes a lot of sense.
Absolutely. And not really particular for fantasy, because you're drafting defenses as a whole, but ACL injuries really impact defensive players as well. They looked at the amount of tackles, amount of fumbles forced and fumbles recovered, all of that, passes prevented, and significant decline in this after ACL surgery. So if you're looking at a defensive team that you're picking and you're really relying on one athlete in particular to be coming back from an injury, you might want to hit pause if that person has a history of an ACL injury.
Agree.
And you really pointed it out really well. So we really worry about wide receivers and running backs in terms of touchdowns, in terms of receptions, and in terms of yards as well too. So pretty much everything that we care about in terms of fantasy football. So not looking too good. Now, I think we should highlight here, we didn't in the beginning, but this is all very, this is what the data says, right? Does not mean we're not going to have an all-star wide receiver that has an ACL injury and comes back and isn't the hottest receiver this year, right? But the data suggests that this has a pretty significant negative impact on performance. And me in particular, I worry about someone that's had two in the same knee in terms of their ability to get back to their pre-injury level of performance.
Yeah, because I think we have to remember that these are the people that have all the resources in the world. They're getting the best, the best surgeons, the best athletic trainers, personal trainers, chefs, all these sort of things to sort of optimize. And the data still doesn't speak very well. So while, we hope they all return and do really well, it's something to sort of know.
Yeah. So take a chance on Kyler Murray.
Yeah.
Maybe pass on OBJ. You heard it here first. Awesome. So before we pass on to foot and ankle, let's talk a little bit about other knee things. So knee cartilage injury, and I think some of these are they're hard to know, right? You can Google NFL ACL and know exactly who's had an ACL tear. But like, do you know the cartilage status of like your wide receiver and running back? Like, you probably don't, but we'll just share it with you. So mild cartilage injury, really no impact on performance. Still maybe impacts the number of games played in career. High level cartilage injury. So what that is 75% or more cartilage loss. So what we're talking about is basically arthritis for our listeners. Significantly impacts performance and ability to play multiple games, which makes sense, right? If you have an arthritic knee, it's going to be painful. It's going to swell. You're not going to be able to play as long or as many games, and you're probably not going to play up to your pre-injury level of play.
Yeah. And I think we've both participated on studies with NFL athletes where we have access, where we've looked at this, the combine data and who's coming in and how they perform. And you do see a lot of guys who had injuries in college, whether it's like meniscus tears or ACL tears or whatever, and they usually have not, it's pretty often they also have a cartilage injury. So really what you're seeing with those is that, the length of the career is generally going to be diminished, because generally that whole process, that whole arthritic degenerative process is just going to advance over time, especially at the level that they're playing. So yes, I
Absolutely.
agree. We're not going to always see in the news, yeah, so and so has a medial femoral condyle cartilage injury.
Yes.
But
It's an ICRS grade 3.
yeah,
And they're like, "Oh, thank you. Thank you so much. I'm not gonna draft them now." I appreciate that.
but if you do see it, beware.
Exactly. Exactly.
And then MCL. So MCL does come up all the time. So for like the lay public, you hear about MCLs all the time, but we rarely hear about them being operated on, as opposed to ACLs. It's everybody who's at that level of play is getting surgery. So an MCL is the medial collateral ligament. It's the ligament that is on the inside layer of our knee, so on the inner thigh side, and it helps with side to side stability. One of the reasons why the majority of these do well is because most of it has a really great blood supply. So we did do an episode on MCL injuries and bracing with Dr. Brian Waterman
Mhm.
this year. So we'll give a little plug to that because that has a little bit more on whether or not they need braces if you're interested. Um, but basically, there was one paper that came out, Ashley. You want to refresh on that for me?
Yeah, so one paper, it unfortunately didn't look at performance. It just looked at games played and career length and found that it was equivalent. But I think we see this a lot, and I would say that just anecdotally, grade 1 and grade 2, they're able to get back. It's very rare to have, a grade 3 distal meaning it separates from the shin bone as opposed to coming off of the thigh bone, and that has a lower likelihood of healing, and so those end up needing surgery, and that's quite rare. So a lot of these can be treated non-operatively and return to sport likely within that season. And there isn't any paper that specifically looked at performance, so we can't really say either way, but they should do well. And then while we're speaking about collateral injuries, MCL, the ones on the outside, same thing. So they didn't really look at performance, but they found equivalent games played. So probably pretty equivalent.
Yeah, agree. And then the last one we'll touch on is patella tendon rupture. So the tendon that goes from the bottom of your patella or your kneecap down to your shin bone. So they, basically, this makes a lot of sense. This is a pretty devastating injury if this happens in a young person, because it's really going to impact your ability to sort of have, kind of big plyometric kind of takeoff strength.
Mm-hmm.
And knee extension strength. And basically, they found that there's decreased performance, decreased games played, as well as decreased career length. So, patella tendon rupture, it's pretty devastating to the career.
Absolutely. And so I think we're about to hit the third one, but there's 3 main injuries in the NFL that really impact performance in a really negative way. We just talked about ACL, patella tendon rupture, and now let's move on to Achilles tendon rupture. So we have an overtime episode on Achilles tendon injuries, and then the treatment, kind of non-operative treatment and surgical treatment. Pretty much everyone in the NFL is getting surgical treatment. It has been shown in some studies to improve plantar flexion strength, which is essentially push-off strength. So that powers them sprinting forward. There's a lot of players that have sustained this injury. Cam Akers, James Robinson, Tariq Cohen most recently last year. So definitely, keeping an eye out on these players. And there are a bunch of articles, and unfortunately, they all show the same thing, which is significant decrease in performance and significant decrease in games played after athletes return to play after Achilles. And unfortunately, very similar to ACL. Though maybe high 70s return to play, only about a quarter are still in the league at about 3 years after surgery. So as you were saying, it's a pretty devastating injury.
Very devastating. This actually just happened locally to our Denver Broncos. So their wide receiver, Tim Patrick, he was actually out last year for an ACL tear, and then in preseason got carted off for what was found to be an ACL injury. So it looks like he is out again, but it's obviously, if it happens, they're out for the season, but it really also has longer term repercussions to their career length.
Yeah, and we'll definitely do, as Catherine mentioned at the beginning, we'll definitely do episodes specific to injuries throughout the season to kind of give you an idea of how long to anticipate someone's going to be out. And as Catherine said, this is one of those where they're going to be out for the season, very much like clavicle, very much like ACL.
Yeah. Great.
So bummer. But the other foot and ankle injuries, not so much. So Liz Frank injury, I think that's a commonplace name now. Like I think it used to be only in the orthopedic community, but now it's reported so much in like the media when someone has that injury. Interestingly, no impact on performance. So Travis Etienne, he was on my fantasy team last year and he did awesome. So I'll take him again because he's apparently going to be just the same when he comes back from his Liz Frank injury. So no impact on performance. performance, but they do have fewer games played. And I think we're kind of seeing this, like having an injury may predispose you to other injuries, maybe a hamstring sprain, an ankle sprain here and there. So they may not be as reliable, but performance shouldn't be affected.
Yeah, agreed. And then two more to touch on for the foot. So turf toe, you hear about that all the time. Excuse me. So no impact on performance. And then Jones fractures, they can be a little bit more finicky. And that is generally you're going to be out for that season, especially if you're having surgery for it. So that's basically a Jones fracture is a fracture of a particular part of your fifth metatarsal. So basically the bone leading into your fifth toe or your pinky toe. And so it doesn't have a great blood supply there. So it can be a little bit finicky. Those guys are generally getting surgery in the NFL. They're going to be out that season, but overall their career length is fine. But the paper that we did see did not report on performance.
Absolutely. So awesome. Well, we hope that you guys found this helpful. If you want to hear about specific injuries as the season is progressing, feel free to message us. Yeah, message us. We are on Twitter. We're on Instagram. You can also email us at thesportsdocspod@gmail.com. You can also message us through our website as well, too, which is www. I think I put too many W's there, just 3 W's, thesportsdocspod.com. We'd really like to hear what you want to hear about. We're definitely going to touch on hamstring, definitely going to touch on ankle sprains, both high and low. The common things that we see, how long do we anticipate people are going to be out with varying grades of those injuries? So we're really looking forward to it, but please let us know what you want to hear more and what you thought about this.
Yeah, good luck with your teams.